Deviated septum surgery, septoplasty, and turbinectomy. Facts: deviated septum surgery, septoplasty, is surgery to correct a deformity in the nasal septum. Turbinectomy or turbinoplasty is the surgical reduction or removal of an enlarged turbinate nasal tissue inside the nose. Both surgeries are done mainly to improve airflow or improve sinus drainage, but may have other purposes such as nosebleed control. There are risks and complications for all surgeries. Those for deviated septum and turbinate surgeries are infrequent, but include the following: nasal obstruction, bleeding, chronic nasal drainage, eye damage, rare, brain fluid leak or infection, rare, numbness of facial structures, septal perforation, alteration of sense of smell or taste, and failure to resolve any associated nasal or sinus problem. Prior to undergoing these surgical procedures, the patient needs to obtain instructions from their doctors, surgeon and anesthesiologist in regard to preparing for the surgical procedure. For example, what medications to stop taking prior to surgery. When the last meals or drinks may be consumed prior to surgery. Deviated septum surgery and turbinate surgery last approximately an hour, and the patient is closely monitored because they usually will be under general anesthesia. Complications rarely occur, and the patient usually can go home the same day as the surgery. After surgery, the patient will need someone to transport them home. To avoid nose bleeding, it is important for the patient to keep their head elevated, and to avoid any straining during bowel movements or exercise. Some mild swelling of the face and nose may occur but is not common, and ice packs can help reduce this swelling. A bag of frozen peas or corn will easily conform to the face, and may provide the most comfort. Following the doctor's instructions in regard to surgery aftercare is very important, and the success of the surgery may depend on this surgery aftercare. Patients will be instructed about nasal packing removal, necessary follow-up examinations, and the importance of the use of nasal irrigation to reduce nasal crusting or scab formation. The surgical site will be very sensitive to normal activities such as lifting objects, wearing glasses, bending over, nasal congestion, and other activities. Thus, these situations should be avoided if possible. If a patient experiences a sudden increase in nose bleeding, a fever greater than 101.5 F 38.6 C, persistent sharp pain, or increased swelling after surgery, they should contact their surgeon immediately. Deviated septum surgery, septoplasty, and turbinoplasty, nasal airway surgery instructions. Note from the doctor: the following information is provided to help patients and their families prepare for deviated septum surgery, septoplasty, and turbinectomy, nasal airway surgery, and to understand more clearly the associated benefits, risks, and complications. Patients are encouraged to ask their doctor any questions or concerns to help better understand these procedures. Nasal airway surgery is almost always performed through the nostrils without the need for external incisions. In following sections, instructions are designed to help individuals recover from nasal airway surgery as easily as possible. Taking care of oneself can prevent complications. The doctor that performs the surgery will be happy to answer any related questions about these procedures. A deviated septum is a condition in which the nasal septum, the bone and cartilage that divide the nasal cavity of the nose in half, is significantly off-center, or crooked, making breathing difficult. Most people have some sort of imbalance in the size of their breathing passages. In fact, estimates indicate that 80% of people, most unknowingly, have some sort of misalignment to their nasal septum. Only the more severe imbalances cause significant breathing problems and require treatment. Deviated septum causes: some people are born with a deviated septum. Other people develop a deviated septum after injury or trauma to the nose. Deviated septum symptoms: the most common symptom of a deviated septum is nasal congestion, with one side of the nose being more congested than the other, along with difficulty breathing. Recurrent or repeated sinus infections can also be a sign of a deviated septum. Other symptoms include frequent. Read more about deviated septum symptoms and surgery. What is deviated septum surgery, septoplasty, or turbinoplasty? Nasal obstruction is often caused by a deviated or crooked septum or enlarged tissues, inferior turbinates or inferior nasal conchae, within the nose. A septoplasty is an operation to correct a deformity of the partition, the septum, between the two sides of the nose. A turbinectomy is the surgical reduction or actual removal of an abnormally enlarged turbinate from inside the nose to improve breathing. The goals of nasal airway surgery include the following: improve airflow through the nose, control nosebleeds, enhance visualization of the inside of the nose, to identify other nasal problems, relieve nasal or sinus headaches associated with swelling of the inside of the nose, promote drainage of the sinus cavities, pictures of the anatomy of the sinuses and turbinates, picture of the anatomy of the sinuses, picture of the anatomy of the sinuses. What are risks and complications of deviated septum surgery, septoplasty, or turbinectomy? Although the surgery will be performed safely and with care in order to obtain the best possible results, patients have the right to be informed that the surgery may involve risks of unsuccessful results, complications, or injury from both known and unforeseen